breathing problems and anxiety. Proper breathing is essential for overcoming anxiety and panic. A simple experiment can prove this. Take a long breath in and a long breath out for a few times and see how you feel relaxed, and your vision also improves noticeably. Our mind has a connection with breathing. When our mind is calm, breathing is normal and deep, whereas when we are stressed, breathing becomes shallow and fast. Sometimes in our hectic, stressful life, we forget to breathe correctly, which is called shallow breathing. When a person comes under stress or anxiety, he tends to use shallow breathing. So check is required to identify such stressful situations and breathe correctly. We need to stop, breathe deep, and continue during work. Sometimes the breathing from the nasal passage gets agitated and leads to anxiety and stress. The person feels pressure bands, forehead pressure as well as brain fog all the time. Some of the possible reasons for agitating air passage are 1. Deviated nose septum or blocked nose. 2. TMJ problems lead to collapsed skull structure and making some small bumps on airways which can produce pressure feeling while breathing. 3. Throat problems can obstruct smooth airflow. Many useful devices can indicate breathing problems using biofeedback sensors. Once the sensor is on, we can deep breathe. But such instruments can only be short-term solutions. While sleeping, if there are obstructions in airflow in the nasal passage, it reduces the amount of air intake and irritates muscles and nerves in the nasal passage where there are bumps or obstructions. These obstructions lead to various kinds of snoring sounds when we sleep. During the daytime, these problems are felt in many ways like brain fog, forehead pressure, etc. Here are some of the disciplines to correct breathing problems. If there is a blockage in the nose like a deviated nasal septum, then do get it corrected from doctor's advice. There are specific devices that prevent snoring as well as an increase in the air we breathe to about 30%. Lack of oxygen leads to brain fog during sleep. It also leads to heart problems and many more problems. Doing breathing exercises like Anulom Vilolam regularly. These will open up the nasal passage properly. But we need to be careful before doing these breathing exercises. Check basic requirements of health before doing these specific exercises. TMJ issues have an indirect connection with breathing. If TMJ leads to damaged or collapsed skull structure, it can lead to breathing problems. So fix TMJ issues as soon as possible. Especially overbite, underbite, or collapsed bite has to be fixed urgently. If you feel stressed, anxious sometimes, just start breathing from the mouth. Loosen the jaw muscles and breathe from the mouth for some time. We will see how magically our stress level goes away. Because of a complex interaction of irritated nerves and muscles in the nasal passage and TMJ issues leading to damage in the throat and ear, we feel more anxious when we try to deep breathe from the nose. Hence, it is better to open up the jaw a little and breathe from the mouth and see how stress goes away. Thank you.